Tom is having difficulty both falling asleep and staying asleep at night. The problem began approximately 6 months ago after the sudden loss of his child. He said this is affecting his ability to perform his job. He has fallen asleep on the job due to lack of sleep from night before. He started using alcohol to help him fall asleep prior to bed. It couldn't help him. He was even more tired. So he decided to consult a doctor. He was diagnosed with a type of sleep disorder. What is it? Sleep-wake disorder are conditions that affect your sleep quality, the duration of sleep, and the amount of sleep you get each night. Sleep-wake disorder can contribute to or be a symptom of other medical conditions. Sleep disorder may also affect your ability to function while you are awake. Types. More than 80 different types of sleep disorder exist and they are divided into 6 general types. Insomnia, circadian rhythm sleep-wake disorder, hypersomnia, parasomnia, sleep-related breathing disorder, sleep-related movement disorder. So these are the general types. We'll see the types one by one in detail. Insomnia. Insomnias are problem falling asleep, staying asleep or waking up too early. It includes short-term acute insomnia. It lasts up to 3 months. That is, it is for a short term. Then long-term, that is chronic insomnia. It occurs at least 3 times a week for 3 months or longer. Circadian rhythm sleep-wake disorder. These are conditions in which sleep time gets out of order. Advanced sleep-wake phase. When someone goes to sleep several hours before normal bedtime and wakes much earlier than other people. Delayed sleep-wake phase. When sleep and wake times are delayed by 2 or more hours. Irregular sleep-wake rhythm. No clear sleep or wake patterns or napping throughout a 24-hour period. It is also called sleep-wake rhythm disorder. Jet lag. It occurs when someone travels across multiple time zones and the body has trouble adjusting to the new time. It is often temporary. Non-24-hour sleep-wake rhythm. When a person's sleep time shifts a bit each day. Shift work disorder. Changing work shifts mean that the body cannot sleep or wake on a regular schedule. It creates constant fatigue, sleepiness at work, or problems falling asleep and staying asleep. Next is hypersomnia. Hypersomnia are sleep disorder that cause a person to be very sleepy or fall asleep at inconvenient or dangerous times, such as while driving. Idiopathic hypersomnia. It creates an irresistible urge to sleep daily. A person may sleep 12 to 14 hours or more out of 24. Idiopathic means unknown cause. Insufficient sleep syndrome. Regularly getting too little sleep. Klein-Levin syndrome. Recurring bouts of excessive sleepiness that comes in episodes of 2 days to 5 weeks, usually seen with a change in appetite, behavior or thoughts. Long sleeper. people who need much more sleep than their peer group. Narcolepsy, an uncontrollable sleep attack or severe sleepiness, can come while eating, working, driving, or walking. May come with the instability to move or loss of muscle tone such as knee buckling. Parasomnia. It involves unwanted events, dreams, or behavior that occur during sleep. The person may appear to be awake but often has no memory of what had happened. Bedwetting. Failing to wake up when the bladder is full. Confusional arousals. Confusion, not knowing where you are or what you are doing when you wake up. Exploding head syndrome. Hearing a loud noise that is not really there just before falling asleep or waking up. Nightmares. Extreme dreams that wake you in intense fear with or without memory of the dream. Night terrors or sleep terrors. Usually seen in children who may scream at night and appear terrified. REM sleep behavior disorder. Acting out vivid dreams as you sleep by kicking, punching, or falling. Sleep eating, binge eating while partly awake. Sleep paralysis, unable to move the body when falling asleep or waking up. It lasts from a few seconds to a few minutes. Sleep talking. It is usually harmless, though it may disturb a sleep partner. Sleepwalking, walking around while asleep. Sleep hallucinations, imagined events that seem real, usually visual, but may include sound, touch, taste, and smell. Sleep-related breathing disorder. These are breathing problems that occur during the sleep time. Central sleep apnea, a temporary stop in breathing during the sleep, usually caused by a problem in the heart or brain, not by a block of the airway. Obstructive sleep apnea, a temporary stop in breathing during sleep. It is caused by blocking the airway. It causes heavy snoring, choking, and gasps while sleeping. Sleep-related hypoventilation disorder, low blood oxygen levels during sleep from shallow breathing. Snoring, a loud or harsh sound made while breathing as you sleep. Sleep-related movement disorder. It causes body movement during or just before sleep, making it hard to fall or stay asleep. Bruxism, grinding or clenching of teeth while sleeping. Night leg cramps, sudden intense pain in the leg or foot. Periodic limb movement disorder, uncontrollable repeating muscle movements that may wake you up. Restless leg syndrome, burning, itching, tingling inside the leg that make it hard to fall asleep or stay asleep. Sleep rhythmic movement or disorder, repeating body movements while asleep or falling asleep. It may look like body rocking or banging. Symptoms. Symptoms differ depending on the severity and type of sleeping disorder. They may also vary when sleep disorders are a result of another condition. Anyway, general symptoms of the sleep disorder includes difficulty falling or staying asleep, daytime fatigue, strong urge to take naps during the day, unusual breathing patterns, unusual or unpleasant urges to move while falling asleep, unusual movement or other experiences while asleep, unintentional changes to the sleep-wake schedule, irritability or anxiety, impaired performance at work or school, lack of concentration, depression, and weight gain. Causes. Sleep problems can be caused by various factors. Physical disturbances. For example, chronic pain from arthritis, headaches, migraines, or fibromyalgia, etc. Medical issues. For example, sleep apnea. Psychiatric disorder. For example, depression and anxiety disorder. Environmental issues. If the light is too bright, or your partner snores, or the temperature may be too high or too low, these are environmental issues. Life stresses such as job loss or change, death of a loved one, or moving away from loved one, illness, etc. Genetic. Researchers have found that genetic basis for narcolepsy. It's a neurological disorder of sleep regulation that affects the control of sleep and wakefulness. Night shift work. People who work at night often experience sleep disorder because they cannot sleep when they start to feel drowsy. Their activities run contrary to their biological clocks. Medications. Many drugs can interfere with sleep, such as certain antidepressants, blood pressure medication, and over-the-counter medications. Poor sleep hygiene or poor sleep habits. For example, watching TV and using gadgets till late at night, then exercising in the evening, and other overstimulating activities, then drinking coffee, tea near the bedtime, then excessive alcohol consumption before bedtime, etc. Aging. About half of all adults over the age of 65 have some sort of sleep disorder. It is not clear if it is a normal part of aging or it is a result of medications that older people commonly use. Diagnosis. The doctor will first perform a physical exam and gather information about the symptoms and medical history. The sleep specialist asks many questions related to your health, sleeping habits, lifestyle, stress factors, underlying medical conditions, and any medications you are taking. After reviewing the symptoms, the doctor will advise to undergo a sleep study. Sleep study is a test which records the body's activities while sleeping. It determines if you have a sleep disorder and also the type of sleep disorder. Polysomnography or PSG. This is a lab sleep study that evaluates oxygen levels, body movements, and brain waves to determine how they disrupt the sleep. Electroencephalogram or EEG. This is a test that assesses the electrical activity in the brain and detects any potential problems associated with this activity. It is a part of polysomnography. Multiple sleep latency test. This daytime napping study is used in conjunction with a PSG at night to help diagnose narcolepsy. These tests can be crucial in determining the right course of treatment for sleep disorders. Management. The doctor will recommend the treatment options based on the type of disorder. The treatment options include cognitive behavior therapy. It is a type of counseling that helps the person to recognize and change the stress triggering factors that is affecting the person's sleep. Medical treatment. Sleeping pills, melatonin supplements, allergy or cold medication, medication for any underlying health issues, breathing device or surgery. This is used for sleep apnea, and dental guard. It is used for teeth grinding. Then lifestyle modification. Practicing good sleep habits, avoiding alcohol, reducing the intake of caffeine, etc. comes under the lifestyle modification. Home remedies. Few home remedies useful in controlling symptoms of sleep disorder includes drinking warm milk at bedtime. Milk has amino acids which induce sleep. Herbal teas like chamomile tea, it has a sedative effect which is a sleep-inducing herb. Essential oils. Lavender essential oil can help in calming the nervous system. Bananas. Bananas has magnesium and potassium. These are two minerals that helps in relieving migraine and sleep problems. Oil massage. It helps to relax and release stress. Warm bath. Warm bath 2 hours before bedtime will help you relax and promote good sleep. Yoga. Practicing yoga, meditation and mindfulness, etc. helps in giving a good sleep. Exercise. Exercise regularly during the day. Take brisk early morning walk for 30 minutes every day. Good sleep hygiene. Practicing a regular sleep schedule, going to the bed at the same time every day. Along with this, take care to dim off the lights an hour before bedtime. Adjust the room temperature as per your comfort. Then have a soundproof windows and minimize loud noises indoor. Avoid watching TV late at night and using electronic gadgets. Limit of the caffeine intake. Avoid alcohol at bedtime. A good sleeping position. Sleeping on the back is best for good sleep. Hope you like this video about sleep-wake disorder. Please subscribe the channel for more videos on related topics. Thank you and keep smiling.